So this talk is about Bowen for Ehlers-Danlos syndrome, hypermobility type. Now, that's an awful lot to unpack, so don't worry about the title for now. It's going to become clearer. So I'm going to just start off by explaining what joint hypermobility is and what it means. So what we're talking about here is a joint that's got above and beyond what would be a normal joint range of movement. So as you see from the picture, the girl's elbow's inside out, and I can show you here already that my elbow is anything but straight, so it's kind of inside out. And you're going to usually find this not just in one joint of the body, but it's more likely going to be all over the body. It could be different joints. Some people's thumbs will be affected, so you might get people who can do interesting things with joints like that. Fingers are affected. My fingers aren't affected, but some people's will have a huge range of movement. You know, the sort of people who can do the sort of clicky thumb joints, those are hypermobile joints. Knees are affected and will look inside out. Jaw can be affected, shoulders, ankles, everywhere basically can be affected. So if you see one hypermobile joint in the body, the chances are you'll probably find more than one. And it's becoming an area of real interest. Certainly physiotherapists now, there's a lot of talks about hypermobility because it's often missed. And once you actually get to know about it, once you recognize it, you almost can't miss it again. So if you're being very clinical, and we don't need to do this as Bowen therapists, you can use something called a goniometer, which is that sort of strange protractor-like implement that we're using there to measure that dancer's elbow. And it's going to be considered hypermobile if it's more than 10 degrees inside out, in effect, if you know what I mean with the elbow there. So there's what we would call generalized joint hypermobility.